Cardiac biomarkers. So this detect myocardial injury effectively, allowing early identification of heart muscle damage. It aids in diagnosing acute coronary syndrome such as heart attacks and unstable angina by measuring specific cardiac biomarkers. Monitors various cardiac-related conditions, including heart failure and ongoing myocardial damage, and the analysis is performed using serum or plasma samples collected from the patient. The cardiac marker panel consists of several analytes that help diagnose and monitor heart-related conditions. Troponin I and troponin T are the most specific and sensitive markers for detecting myocardial injury. Their levels rise within hours after heart muscle damage and remain elevated for several days, making them essential for diagnosing acute coronary syndrome. Creatine kinase MB, or CKMB, is an enzyme found mainly in cardiac muscle. It rises earlier than troponins but is less specific since it can also increase with skeletal muscle injury. CKMB is useful for detecting reinfarction or ongoing myocardial damage. The panel may also include a BNP, or its inactive fragment NT-proBNP, which are hormones released by the heart in response to increased wall stress. These markers are valuable for diagnosing and monitoring heart failure, helping assess severity and guide treatment. So together, these markers can provide a comprehensive picture of cardiac health, aiding time diagnosis and management. So elevated troponin levels can indicate myocardial injury, making it the gold standard marker for detecting heart muscle damage, such as in an acute myocardial infarction or a heart attack. CKMB also rises with cardiac injury, but is less specific than troponin since it can be elevated in skeletal muscle damage as well. CKMB is useful for detecting reinfarction or ongoing injury. An elevated BNP can suggest heart failure, reflecting increased cardiac wall stress and fluid overload. Serial measurements of these markers are critical for accurate diagnosis and monitoring, as trends over time help differentiate acute injury from chronic conditions and guide treatment decisions.